We are recording this. We are going to share slides. Feel free to take notes, but know that we are going to share out the recording and the slides with everyone who registered. So if you have colleagues who registered but aren't able to make it, we're going to share this out with them. And we're also going to post it on our website, the recording, just like we did for our advocacy one. I'll mention that at the end, but I'll mention it here at the beginning. If you missed the Advocacy 101 training last month, that's recorded and we do have the slides available. I can point you to that on our website, or you can email me if you have questions about that. In presenter mode, it's a little hard for me to monitor chat. I'm going to pull it up here. Okay, I think I can handle this. So you can put questions in the chat. We are going to have a question and answer session at the end. So feel free to save questions for that. So we're going to kick things off. I didn't put a intro slide with names, so I'll just introduce myself and I'll introduce a couple of people that are also presenting. My name is Markel Miller. I'm the director of the Community Food Programs team at Food Gatherers. We are the food bank serving Washtenaw County. We do sponsor one of the programs we're talking about today, the Summer Food Service Program. We'll go into detail about that, but the name is pretty descriptive. We help provide free meals to kids in the summer when school is out. And we also do advocacy work at the federal level. So we're in strong support of having good nutrition programs available in our community. And so that's why we're doing this training today, to help all of you, all of our community partners, understand these important programs. I also have Stephanie Willingham from the Michigan Department of Education here with me today. I'll spotlight you when you're talking. I think it'll work automatically. And then I have Kate Squire, also from the state of Michigan. She's within the Department of Health and Human Services. She's going to be talking about WIC. And then I have Diana McPeak, and she is with the Washtenaw Intermediate School District and is going to talk about Head Start program. And I would love to hear from you all as we go too, if you have questions or anything to add. So we're going to get started. We're going to cover quite a bit today. We're trying to keep this high level and simple, recognizing that this can get complicated really quickly. What's important for us is for you all to understand these really important programs on a quick basic level. What do they do? So we're going to do an overview of all the programs. We're focusing on federally funded nutrition programs. So these are the commonly referred to as child nutrition programs. Then we're going to break down a little bit the different roles of all of the different governmental agencies and legislative bodies that can provide rules and regulations for these programs. So we'll talk about Congress, the US Department of Agriculture, and then here at the state level, the Michigan Department of Education, as well as the Department of Health and Human Services. And then of course, how local offices or local school districts and schools can also influence how these programs operate. We're going to talk about some advocacy opportunities. So those are on your radar for later this summer and fall. And then of course have time for Q&A. So with all that, we're going to get started with an overview of child nutrition programs. Stephanie is going to go up first with walking us through some of these nutrition programs. She's going to talk about all of the school ones and the child and adult care food program. Stephanie, it's up to you. If you want to just blast through and talk about summer food, you can. I'm happy to do that too, either way. And then we're going to have Kate talk about WIC. Okay, Stephanie, you're up.
All right, sounds good. Thank you for having me today. I am going to actually stop my video because I do have notes, and it's going to look really weird if I'm looking way over here and not at the camera. So if you don't mind, I will stop it and I'll turn it back on when I'm done. So, okay. The Office of Health and Nutrition Services, which is housed within the Michigan Department of Education, oversees the administration of a bunch of federal child nutrition programs. And so we oversee the National School Lunch Program, which I think most people are familiar with. And then under the school lunch program, we have the Seamless Summer Option, which is new this year, and I will highlight in a minute. And we have School Breakfast Program, the Fresh Fruit and Vegetable Program, and the Special Milk Program. We also oversee the Summer Food Service Program, known in Michigan as Meet Up and Eat Up, and the Child and Adult Care Food Program. So like I said, you probably heard of the National School Lunch Program. It was established in 1946 and provides meals to children during the school day. Sponsors must serve lunches that meet federal meal pattern guidelines and offer the lunches at a free or reduced price to eligible children. So children are determined eligible for free meals through participation in certain federal assistance programs like the Food Assistance Program. If they're homeless, migrant, runaway, foster child, families can also fill out free and reduced school meals family applications to see if they qualify. That's a little bit different this year, but I'll get into that in a second. School lunches are healthy and include a variety of vegetables, fruits, whole grains, meat alternates, and milk. Schools can also provide after school snacks at their locations, and in order to be reimbursed for that snack, the program must include an educational or enrichment activity. So they do have to have some sort of activity if they're doing an after school snack. So that was the description of like normal school lunch, right? So this school year things are a little bit different, as the USDA, the United States Department of Agriculture, Food and Nutrition Service, has provided flexibilities through waivers. So all children are able to get free meals through the National School Lunch Program's Seamless Summer Option. The Seamless Summer Option is not a new child nutrition program, but it is new to Michigan because we have never administered the program. Typically, Seamless Summer, it runs in the summer, right? So it coincides with a summer food service program, but it pays at a different rate. The regulations are a little bit different. And so in Michigan, we have always just streamlined having the summer food service program. But this year, we did add the Seamless Summer Option, and most schools have decided to use that. So all kids in the state of Michigan that are receiving meals, breakfast and lunch at school, will get those free. So with that being said, although the free and reduced price applications aren't required for kids to receive a free meal this year, schools are being asked to continue to collect them for other educational funding allocations, because the school meals applications are also tied to things like Title I allocations that the district will get. That is dependent on by building. And so we are asking schools to continue to collect those applications. So then I will talk about the school breakfast program. The school breakfast program really goes hand in hand with the National School Lunch Program and works in the same way. The past few years, Michigan has been working hard to increase breakfast participation, including doing a statewide outreach campaign with No Kid Hungry and working really close with United Way for Southeastern Michigan. So prior to the pandemic, we were turning a corner and statewide breakfast numbers were beginning to increase. And then we were hit by a pandemic. This school year, all students, like I said, with the school lunch program, all students in Michigan will receive free breakfast, and many will be grabbing a breakfast as they walk in the building. They'll be eating breakfast in the classroom. Those things didn't always happen prior to the pandemic. So we want to make sure that momentum continues and kids have increased access to school breakfast, because they really need to start their day with the fuel that they need to learn. That's really important. Okay, so now we have the Meet Up and Eat Up Summer Food Service Program. This program provides meals to children 18 and under during the summer months when kids do not have access to the meals they would get during the school day. It's an interesting program, as it began in 1968 and was an amendment to the National School Lunch Act, and really hasn't changed much since 1968. So there is a lot that could be updated to make the program run a little smoother and increase access to children. Sponsors operate sites that are in low-income areas where at least 50% of the children are eligible for free and reduced price meals, or if the site is eligible based on census data. And so the USDA has a census map that we can use to see if sites are eligible to run the summer food service program. As with the school breakfast and lunch program, summer food service program sites have to follow specific meal patterns that it's a little bit more simple than the National School Lunch Program, but it still includes vegetables, fruit, grain, meat alternate, and milk. Sites can offer up to 2 meals per day, and children must eat those meals on site. So that's how summer food is supposed to run. That is not what you have been seeing for the past 2 summers due to the pandemic. So things are a little different due to COVID. This summer, federal waivers have offered the flexibility of removing that congregate feeding so kids don't have to stay on site. and removed the area eligibility requirements. So that means that any sponsor that has a site across the state of Michigan can feed kids for free. We did not have to worry about area eligibility. Now that will probably change after this year. That does end at the end of summer this year. And so we will see, maybe during Child Nutrition Reauthorization, something might change with SFSP. So we'll have to keep an eye on that. Sites can offer, right now, sites can offer children up to 7 breakfasts and 7 lunches at one time. So they used to be able to get 1 meal per type per child per day. So a breakfast and a lunch, but you had to eat it on site. Now children can receive up to 7 breakfasts and 7 lunches per day, or I'm sorry, for the week, but in one day. And this has really helped to provide more meals to kids and reduce the transportation burden on families, since now families don't have to go to a site 2 times a day, every day, to get a breakfast and a lunch. The Child and Adult Food Care Program provides reimbursement for nutritious meals and helps develop positive eating habits for children enrolled in non-residential child care centers and daycare homes. So children from birth through 18 years of age and adults 60 years of age or older and functionally impaired adults of any age can receive meals through the CACFP. Child care centers apply for CACFP participation through the Michigan Department of Education as an independent center or under a sponsoring organization. Participating centers can be approved to receive reimbursement for up to 2 meals and 1 snack, or 2 snacks and 1 meal per day. So they also have to meet meal pattern requirements that are outlined in the CACFP regulations, just like our other child nutrition programs. And they are a little more strict than the National School Lunch Program, because you want to make sure that the littles have a really good start to their life and have really good nutrition, and that they can look at that and see the pattern of what they should be eating as they get older. So by educating our young people at an early childhood level and introducing them to a variety of healthy, fresh food items, we're creating habits that we hope will roll into their teen and adult lives and improve their individual nutrition standards. We really want to make sure that kids understand too where our food comes from. And so we are really, really trying to advocate for farm to institution and making sure that sponsors understand the importance of having whole foods, so kids know what their food looks like before it's processed. So finally, we have the CACFP at-risk after-school snack and supper program. Any public or private nonprofit organization providing licensed or approved non-residential childcare services can participate. And they include like childcare centers, Head Start, 21st Century Learning Centers, emergency shelters serving homeless children, and daycare homes. So organizations providing after-school care to youth up to 18 can qualify for a snack and supper reimbursement. The after-school care must be located in attendance area of a school where they are at least 50% eligible for free or reduced price meals. So like I said, they can receive reimbursement for up to 2 meals. So that's 1 snack or 2 snacks or 1 snack and like a supper. Meals have to meet the meal pattern requirements identified in the CACFP regulations. Children have to be enrolled, and they do have an education component. So you have to make sure that there is some nutrition education, some sort of learning components. And right now that can be done virtually. So it doesn't have to be done on site. It can be handouts or flyers or websites that kids can go to. You can be pretty imaginative when it comes to the education they receive right now. So right now, the USDA provided flexibilities for all meals in CACFP to be reimbursed at the free rate. And so that's huge because we have a lot of child care centers, our sponsors, that struggled because they weren't able to have kids, right? So for many months, kids weren't going to daycares. And so they were losing money. They're having a hard time finding staff. And so the USDA really stepped up for all of these programs to provide higher reimbursement rates to help our directors feed kids as much as they can. And that's all for me.
Awesome. Thank you, Stephanie. So we're going to have Kate go. And again, everyone, we have question and answer session at the end. So definitely hold off questions till then. You can put questions for clarification in the chat and we can try to answer those, but questions that you'd like a response from Stephanie, we can have at the end. So Kate, you're up next to talk about WIC.
All right, thank you, Markel. I'm also going to turn off my video because I have my notes on a second screen here. So I'll turn it back on when I'm done. You can move to the next slide. All right, so I am here today to talk about the WIC program. This is another federally funded program. It is, the official title is the Special Supplemental Nutrition Program for Women, Infants, and Children, but much easier to say is just WIC, which is what we usually refer to the program as. It is for women who are pregnant and postpartum, infants, and children up to their 5th birthday. We have a couple of different categories for serving postpartum women. If they are non-breastfeeding women, then they are eligible for the program for up to 6 months after an infant's birth. If they are breastfeeding partially or exclusively, up to an infant's 1st birthday. You can go to the next slide, please. So what does WIC provide? A lot of people know about the food package, and I'll talk a little bit about that, but we also provide several other different resources that are basic tenets of the program and really important to a full WIC experience. So we have a supplemental food package. This is not meant to be what a person needs for all of their food needs in a specific month that they're receiving benefits. On our website, which is michigan.gov/WIC, you can go and click on a link that says WIC Foods to look at our food guide that shows all of the wonderful foods that are available. It is very detailed, but I'll go through just some basics of the food package. Clients can purchase fresh fruits and vegetables or frozen or canned. They get a certain amount of dollars per month based on their category to spend on whatever fresh, frozen, or canned fruits and vegetables they'd like. Dairy products, that is either whole milk for infants from age 1 to 2 or lower fat for older kids or women. There are cheese and yogurt options, eggs, peanut butter or beans, whole grains like bread or tortillas, cereal, and all of the cereals have high iron and folic acid, juice that is high in vitamin C. So these foods are determined and have really specific nutrients in them that are, this package is built to help support the nutrition needs of these specific age groups, infants, children, and then women before and after pregnancy. We also have a program called Project Fresh, which operates in the summertime. And this is an additional benefit that clients may be eligible for and receive that are vouchers that can be used at farmers markets to purchase fresh fruits and vegetables. If a child is being an infant is being formula fed, we offer infant formula. And then additionally have some specialty formulas that may be for babies that have specific medical conditions or women who are in need of additional nutrition. And we work with medical providers to determine what's best. And Michigan was one of the first states to start using EBT electronic benefits cards, like a debit card for benefit issuance, which made redeeming benefits a whole lot easier for our clients. We do provide nutrition education and counseling. So we have handouts, verbal education, tips and tricks that people can use when feeding their infant and toddler. We also have an online portal called wichealth.org where clients can go and complete nutrition education lessons. And if a client is high risk nutritionally or requests this even, they can be referred to and seen by a registered dietitian at their WIC clinic. And the dietitians work in collaboration with medical providers and sometimes hospital dietitians. And WIC registered dietitians can be a really vital part of a client's treatment plan, especially if a child is having some really complicated medical issues related to their nutrition and their consumption of food. We provide breastfeeding education and support. So clients have access to breastfeeding education through certified lactation consultants and peer counselors, which are women who have breastfed and can kind of share their experience and knowledge and work one-on-one with clients. We also issue out breast pumps for those who need them. Some of them are for keeping, others are for loan only, and then they send them back to the WIC clinic, depending on the situation and what type of pump they might need. And then we provide referrals to healthcare and other community resources. So during an appointment, a client is always asked about their health insurance status. We also ask about substance abuse and if they need any referrals. There is a required federal question to ask if the adult is registered to vote, and if not, would they like to register to vote? And then we provide referrals to other community resources like a food pantry. Okay, you can go to the next slide. So who is eligible for WIC? This has, the program has a little bit of a different eligibility guideline than other programs. So the income cap is a little bit higher than other programs. So this serves low-income families, of course, but then also families with a more moderate income. So we update our income guidelines every June. And this is our most recent chart that has been updated, and it is posted on our website. So again, this is a public resource. You can go to the Michigan WIC website and click on WIC eligibility and see this kind of thing if you're curious to know about the eligibility guidelines. And Markel, can you go to the next slide, please? And then I also wanted to talk about adjunct eligibility. So when we're talking about other programs and talk about the community eligibility provision, this is similar to that. So when people are enrolled in one program, they may be eligible for another because they meet the requirements for one. So anyone who's enrolled in SNAP automatically meets the income requirements for WIC. And then when clients are enrolled in Medicaid, they're also adjunctly eligible for the WIC program. So we do have some outreach efforts. And I wanted to also flag that my colleague Whitney Jackson is on the line. She's our WIC strategist and leads our promotion and retention efforts. So if there are questions related to our outreach efforts, Whitney is on the line, can answer those later on. Okay, next slide, please. So now I'll talk a little bit about the different roles that these different levels have. And it is sometimes complicated. And I know Markel will go into this in a little more detail later, but I will do my best to be kind of high level about this. So Congress will pass a spending bill, and then that will go on to USDA, and they are responsible for distributing that funding out to states. But there are also some things that might be included in a bill that comes from Congress that are requirements for initiatives that are timely. So for example, in a most recent spending bill, Congress required that USDA form a research committee to look into online ordering options for WIC, which is not currently allowed. Like you can start to do that a little bit with SNAP benefits, but it's not currently allowed for WIC. So they have to then provide a report back to Congress by a certain date. So these are the types of things that the federal government would be involved in for WIC and other programs. And then USDA also makes guidelines for how the program needs to be administered. And they determine which foods can be part of the program, can be offered on the program, and then look at different science-based organizations to help determine what needs to be in that package. So the dietary guidelines and the NASEM guidelines, the National Academy of Science, Engineering, and Medicine, I believe that's what that stands for. Those are two that they look at to see what nutrients are needed for specific population groups and help form the guidelines for our food package. At the state level, where we administer the WIC program in the Department of Health and Human Services, we have the opportunity then to make decisions on some of those allowable foods. So food packages look different from state to state, and a lot of that depends on cost and availability of items. We want to make sure that the foods that we're offering are available in every part of the state, not just for some people. And then also take into account cultural appropriateness. So there are specific population groups in Michigan that prefer different foods. And so we want to make sure that we have options for folks to help meet their needs. So we also at the state level provide technical assistance and oversight related to audits and what we call management evaluations for the local agencies. We provide training, moderate work groups for specific initiatives, interpret that federal guidance and kind of put it into terms that are easier to understand for our partners. And then I also want to mention the role that vendors have. This is not necessarily state government, but it is a very important part of the program. So we work with vendors across the state, like grocery stores, to then offer these foods. So you can't go to every single store to use your WIC benefits. It's a little less available than being able to use your SNAP EBT benefits, but that is because of the specific nutrient requirements that our foods offer. And we want to make sure that the vendors that we work with have a minimum stock and have a minimum amount of variety for clients to choose from. The local agencies are kind of like the umbrella organization for clinics. So think of it like Food Gatherers is the umbrella organization for food pantries in Washtenaw County, and then they have the pantries, or what we call clinics, underneath them. So it's a similar structure there. Some local agencies are their only clinic in the county if it's a less populous area. And then others have many clinics under their umbrella. So they'll make decisions about local issues like how to schedule their clients based on their staffing, some procedural decisions, or how they'll process certain parts of the program, and then their local outreach efforts. And then the clinic level provides the direct service to clients. And I believe there are 7 clinics in Washtenaw County. And the staff there will go through the eligibility process. They'll do screenings. They will do the referrals to other resources, provide education, and then also assign food packages and do the tailoring of the food package when appropriate. So for example, if someone said, I would like lactose-free milk instead of regular milk, then they would go through that process and ask some questions and figure out what it is they need. So that one-on-one interaction with the clients happens at the clinic level. And right now we are operating under some waivers from USDA related to the pandemic. So there is not a requirement to be physically present in a clinic. So a lot of services are happening remotely or over the phone or over video right now. And I just have one more slide if you want to move forward. And I just wanted to provide some contact information. I know my email is at the end of the presentation here, but my phone number at the state, and then also the phone number for the Washtenaw County WIC office. And I'm not sure how many of you know the folks over at the WIC offices in Washtenaw County, but I did check with them, make sure it was okay to share the phone number in case you have any clients who may be eligible or have questions about WIC, they can be referred to that phone number. That's it for me.
Awesome. Thank you, Kate. That was so helpful. Great overview. And thank you, Stephanie, as well. So we are going to talk about all of the different governmental entities that can influence and make rules about the child nutrition program. So I want to do a quick walkthrough, talk about the national level, so Congress and the U.S. Department of Agriculture, and then here at the state and local level. So getting kind of narrowing down that funnel. So first up is Congress. So they are the entity that basically says these programs exist and there's money for them. So they're like that super high level decision maker entity that's creating them and funding them. They also update these programs. So all of these programs that Stephanie and Kate talked about already exist. Some of them have been around most of them have been around for decades. And so every couple of years, Congress, through Child Nutrition Reauthorization, which we'll talk about more later, they update these programs. They look at, are there any things we need to refresh that we haven't looked at in a long time? Are there anything that we need to change? Are there any new grants or services we need to add? And so those happen. And then some programs are also impacted annually through the appropriations or the budgeting process, like how much money do we have to spend and on what? And then some programs get money appropriated, but they're also flexible and can scale to serve as more people are needed. So like the school meals programs will always be able to provide free meals for kids if people are eligible. There's not necessarily a cap on that. And the Congress also looks at the program eligibility and nutrition guidelines. Some level of that detail is included in their laws, but what they end up doing ultimately is telling USDA, here's the program, here's the funding, and you put that into action. So a lot of it is sometimes high level detail, and then USDA is tasked with making it, fleshing that out, putting that into rules, getting all the specifics. For context here, the last time Congress updated the child nutrition programs, it was in 2010. That was the last time they did child nutrition reauthorization. That was the Healthy, Hunger-Free Kids Act of 2010. It updated nutrition standards for school meals that hadn't been done in a while. It actually increased the reimbursement, which hadn't been done in several decades. It required USDA to establish nutrition standards for other meals sold in schools. It established the community eligibility provision, which we'll talk about, which helps make it easier for schools to provide meals at no cost to families. And it transitioned WIC from paper vouchers to EBT, which Kate mentioned. So the Healthy Hunger-Free Kids Act of 2010 was really groundbreaking and really updated a lot of these programs. You might be thinking like 2010, that was 11 years ago. Why has Congress not done anything? As I mentioned before, all of these programs are permanent programs. So even though the Healthy Hunger-Free Kids Act of 2010 expired in 2015, these programs didn't. So that's why they've continued to operate. There were a couple of special pilots and special grants that were connected to that bill package. So those have not been offered since September of 2015 because the funding for that did expire, but the actual main programs continue to operate, and they're not vulnerable because Congress hasn't taken action to pass a child nutrition reauthorization bill. So then I mentioned USDA. So that's the U.S. Department of Agriculture. They are in charge of a lot of things. Obviously, agriculture, making sure our farmers can grow crops, sell crops, distribute that. That's a very volatile industry, subject to weather and changes in supply and demand. So they have a lot of programs to support farmers and agriculture. And the U.S. Department of Agriculture has another branch called the Food and Nutrition Service, and they run all of these nutrition programs. There's 15 nutrition programs altogether. That includes the child nutrition programs we're talking about today, as well as SNAP, which is the largest nutrition program. That provides a benefit on an electronic benefit transfer card. You can use it like a debit card at approved retailers, and that's so people with lower incomes can buy groceries. It doesn't determine what they buy. It's very different than WIC in that regard, and it provides on average a much larger benefit. So WIC is a very targeted specialized program, and SNAP is a broader program intended to reach more people. There are other nutrition programs that the U.S. Department of Agriculture Food and Nutrition Service branch runs, including some emergency food programs that support food banks, for example, but we're not going to focus on that today. The Food and Nutrition Service also looks at the dietary guidelines. So they do that in partnership with a division within the Health and Human Services Department, but they also have input on that. So the USDA really looks at providing rules and guidance for the state agencies like the Michigan Department of Education as they operate these programs. So they review state plans, they approve waivers. So there's sometimes flexibility for different things that states can do, they don't have to do. And so USDA would make sure that those options are allowable. But a lot of it is monitoring the state's implementation of these programs and ensuring that they're following the USDA rules. I will clarify a little bit of kind of a civics difference here. The stuff Congress does is considered legislation. So those are laws or statutes. USDA is an administrative body. It's within the executive branch, and it passes rules. So it provides guidance and rules and regulations for how these programs work. So if you're interacting with USDA and providing feedback to them through they ask for comments about a proposed rule, et cetera, that is not part of the legislative branch. So that's not considered lobbying if you're interacting with USDA. So just a little nuance there for that. Okay, so then USDA works with all of the states, and so they have to operate these programs. So here in Michigan, the state agency that is in charge of the child nutrition programs is the Michigan Department of Education. excluding WIC. So we'll talk about that. As Kate mentioned, that's run by the Department of Health and Human Services. And the Department of Health and Human Services also oversees SNAP. So the Department of Education here in Michigan oversees all of the school meal programs, the child and adult care food program, and including the summer food service program. The state agency administers these programs. They communicate closely with USDA, make sure they're following rules, but then their role is to really look at, are these programs reaching all the families and children that need it, and how are local schools or local nonprofits or public or for-profit entities like doing childcare centers, like Stephanie talked about, how are they running these programs? And they provide oversight and support for all of those. So they kind of make sure all of these programs are working throughout the state and in the communities. The local education authorities are your public school districts, charter schools, private schools. These are the people and groups on the ground that are running these programs. So they operate the school lunch program or the school breakfast program. They are considered sponsors. They have to submit an application and a lot of paperwork to the Michigan Department of Education. So that way the Michigan Department of Education can fully vet that these programs have the financial stability, the administrative capacity to run these programs. Meals are provided to families and then are claimed to the state for reimbursement. So this is an important distinction because entities that run these programs have to be large enough to front the cost. They get then reimbursed for meals provided to families that are eligible for a free meal, and they get reimbursed for that. But that doesn't come until after they've provided the food, paid for it, paid for the staffing, and then claimed those meals to the state. The local education authorities do have the ability to decide what foods are served. As Stephanie mentioned, there are meal pattern requirements, there are nutrition standards. Those are determined by USDA with direction from Congress, but the local entity does have decision. Are we providing apples this week? Are we providing cherries this week, et cetera? So there is a lot of still choice and flexibility in what the programs look like that happen at the very local level. Okay, so that was a lot there. So now I want to mention a few other important programs that are really helpful to understand the context in which these school nutrition programs and child nutrition programs are being operated. I'm going to turn it over to Diana, if you can unmute yourself and then talk a little bit about how Head Start works here.
Yes, thank you, Markel. I am also going to keep my video off. Again, my name is Diana McNeek. I'm with the Washtenaw Intermediate School District Head Start and Early Head Start programs. My title is the Head Start Health Specialist. So I oversee all the Head Start and Early Head Start sites and programs to make sure they're following the federal Head Start program performance standards, which includes anything health related, nutrition, safety. So yes, nutrition is a big part of our program that we incorporate with our families and classrooms. So I just want to give you a little bit background of our programs in Washtenaw County. Again, WISD, the Washtenaw Intermediate School District, is the grantee. We have 427 federally funded slots at 8 Head Start sites at the Ann Arbor School District, Ypsilanti, Whitmore Lake, and Lincoln School Districts. We also have an Early Head Start home-based program. So Early Head Start, if we have a family enrolled, they would have a home visitor that would visit them weekly in their home. And then we help them with the transition process when they're ready to go to Head Start. To qualify for Head Start, you have to be at 100% or below the federal poverty level. So for example, a family of 4 would have to make under $26,500 per year. So our guidelines are a little bit lower than what you saw for WIC. Some things we do with nutrition. Well, again, I want to go back in case some people don't know about Head Start. Head Start, we serve the most at-risk families in the community. So mostly our lower income families, family with high risk factors like homeless, foster care. So one thing that we do with nutrition is at our Head Start sites, all of our Head Start classrooms are in school districts. So of course, they utilize the National School Lunch Program. We also utilize CACFP. A lot of our sites use CACFP to buy their snacks. So we get the breakfast and the lunch provided from the National School Program. And then we utilize CACFP funds for snacks, which we do in the afternoon. All of our Head Start students enrolled in our sites do qualify for free meals. That includes breakfast and lunch. And breakfast and lunch does have to be provided for every Head Start student. So for example, if a student arrives late at their Head Start classroom, we still have to ask if they had breakfast that morning and still offer it to them. Some things we do with nutrition is we partner with WIC very closely. Whenever we do an application for the program, that's one of our questions we ask. Besides, we help families make sure they have health insurance, a medical home, dental home, and we ask if they have WIC. If not, we do a referral right away. And I kind of monitor that throughout the school year because we have new students coming in later. And I share with our local WIC office with Guy, which students do not have WIC and family information, and then she will contact that family directly. So we really do work hard to have all of our Head Start kids on WIC. The last report I ran, we have 75% of our Head Start and early Head Start kids on WIC. So I'm working to get that a lot higher. Of course, we want it to be 100%. We also partner with the University of Michigan dietetic interns. Last year, of course, we were all virtual, but the year before I had them working with our early Head Start families. So they would go out with the home visitor, take like nutrition information. We did an in-home nutrition activity. The last one I remember we did was we made homemade applesauce, which we had the kids and the parents help with that. And we'll be looking at how we are going to use them in our Head Start classrooms this coming up year. Of course, we have food gatherers that come out to our Head Start and school sites, and we make sure our families have that information and get involved with food gatherers. We also make sure our families are aware of the Cooking Matters at Home, MSU EF, I always say that wrong, I'm sorry, FNEP, the Expanded Food and Nutrition Education Program under MSU. This last year, since we were virtual, Cooking Matters did some virtual trainings for us for our early Head Start families. And we also always make sure that all of our Head Start and early Head Start families receive their information of any upcoming trainings that they can join in the community. We also use the National Kidney Foundation Reggie's Rainbow Adventure Healthy Nutrition Curriculum for Early Childhood. So a lot of our classrooms are using that Reggie Rainbow Adventure. We are always looking to expand our nutrition education components for our Head Start and early Head Start families. So I'm glad I'm here and to help network to see what else we can do to get more nutrition information out to our families. And that's all I have, unless there are any questions.
Thanks, Diana. So much good
Thank
stuff
you.
there. Okay, so the last thing I'm going to talk about real quickly is this community eligibility provision. You hear about this sometimes, and this is a pretty kind of behind the scenes technical option that allows schools or school districts to provide all students a meal for free. It's an administrative thing. It basically says, hey, we have enough data about our students in terms of eligibility in other programs like SNAP or TANF, which is the Temporary Assistance for Needy Families program. And then there's also Medicaid. And so there's different data that schools or school districts would have about their families and saying, hey, we don't need to collect applications from individual families. We know that a large portion of our families are eligible for a free or reduced price school meal. So it streamlines administration of these programs. The applications are collected annually, and you also don't have to track which kids eat because all kids get an access to a free meal. And then the school or school district gets reimbursed based on the ratio of the total students who are eligible for a free or reduced price meal. The reason I bring it up is because it also connects to a couple other programs which have been in play during the pandemic and may be options depending on if Congress takes action in the future. You might have heard about the pandemic EBT or PEBT that provided families who are eligible for free or reduced price meals benefits on a EBT card similar to SNAP. It was an automatic program, and then that's continued this summer through the summer EBT program. Those benefits go to any family eligible for a free or reduced price meal. So that includes all families at schools or school districts that are using the community eligibility provision. So a local example here is the school district Ypsilanti Community Schools. They utilize the community eligibility provision. So when the pandemic hit, all families there got the pandemic EBT benefits, regardless of their individual status. So it's really important remembering that these are federal programs. There's a federal guideline for eligibility, and in areas with higher costs of living, we may have families who are right above that threshold, and they individually would not be eligible for a free or reduced price meal. But if their school district utilizes the community eligibility provision, that family would get the benefit of a free meal during the school year, as well as the additional benefit of summer EBT if that program continues. So I want to bring that to light because it's a really great new option that came out of the last Child Nutrition Reauthorization. And something that we love to see utilized and supported. Okay, so with that, I want to put a few advocacy opportunities on the radar. I'm going to go through this pretty quickly because I want to make sure we have time for question and answer. So you can start putting any questions you have in the chat box too, and we'll get to that in just a second. So right now, Congress is working on a COVID recovery bill. This is part of the infrastructure bill. It's part of budget reconciliation. There's a lot of things going on in Congress. They're trying to look at what actions are they taking to support the economy, to support families, to support businesses as part of COVID recovery. And there's two things related to child nutrition or families that are being discussed that we want to bring your attention to. If you want to learn more about that, I'm going to share a link to sign up for advocacy alerts from us, but there's an opportunity to make the summer EBT program, which I just talked about, which provides benefits for families on an EBT card so that they can purchase groceries in the summer if it's hard for them to get to a summer meal site. Congress is considering potentially making that permanent, and that would be a fantastic resource for in perpetuity, not necessarily connected to this public health crisis. And then the other thing that might be included that we're looking to see is the extension of the child tax credit. That was included in this last COVID recovery bill, or not the last one, but the one from December, if I recall. So families are starting to get child tax credit, and there's also the expansion of the earned income tax credit, which is an amazing thing, particularly for families with the lowest incomes. It's providing now additional tax credits for them. Previously, they were ineligible for that if their incomes were too low. So those are two great resources that are really helping families with lowest incomes, and we'd love to see Congress continue those. There's some administrative advocacy opportunities also. I mentioned this earlier, this is not considered lobbying because you're not asking an elected official to take action. This is providing input to USDA as they determine how they run these programs, how they change services. Based on an executive order from President Biden, all administrative departments are looking at how they can address racial equity through programs and services and policies that they control. And so USDA has put a request out for information from everyone, from state agencies, from school districts, from you, from community members. How could they improve their programs or policies to address racial equity? So that comment period is open through August 15th. There's a link here. Again, we'll send this out in the follow-up email to everyone who registered. It's very simple. You can submit comments online, and there's a lot of direct opportunities to share feedback about how policies have unfairly treated people. You don't necessarily have to have a suggestion. You can just point out something that's not working. So it's a great opportunity. You don't have to submit comments on behalf of an organization. You as an individual can submit comments. Just so you know, comments submitted are public. So keep that in mind, but anyone is welcome to do it, and it's not considered lobbying. And then lastly is Child Nutrition Reauthorization. This is happening later in the summer, fall. Congress is working on that recovery bill right now, but we're hoping to see Child Nutrition Reauthorization happen. So we'll be sharing more information about this as well. There's great opportunities to update and improve the summer nutrition program specifically, and really allowing some streamlining, helping make sure these programs are talking to each other and that they better coordinate and serve families. As Stephanie mentioned earlier, the summer food service program was a wonderful program, but it's a bit out of date in how it's structured. So we're really hoping to modernize that, take some of these lessons learned from COVID, and improve that program so we can provide that resource to families in the summer when logistically it's a lot harder because school is out. Okay, so with that, we got some Q&A. We had a comment earlier about private schools being able to run these programs. And then a question here, are churches eligible to provide meals to children and adults over the summer during Vacation Bible School and other summer activities conducted for children and adults, specifically churches in underserved communities? So the short answer is, if it's in an area that's eligible, it might be eligible for summer meals. The church could be the sponsor for the summer food service program. In most situations like this, you would work in partnership with an existing sponsor, like a school district or a food bank, or the YMCA or something. And so that's how that would happen. Meals can't go to adults with any of these programs, so that is a limitation. The child and adult care food program that Stephanie talked about is a specific daycare program, like a senior center type thing where people get dropped off and it's a daycare. So it's not adults, parents of children in that situation. Stephanie, did you want to add any information about that kind of nuance of a church doing Bible school and how they could use summer meals?
No, I think you got it. The biggest thing is start early. So if you know that you are interested in providing meals through the summer months, you can always contact the Michigan Department of Education, and we can help set you up with a sponsor that you can work with early on. So that way you can have everything in place prior to like May. A lot of sponsors start figuring out what they're going to do in the summer, like February, March, April. And so it's really important to try to do that as early as possible. Note that next year, eligibility requirements might be back on the table. And so you will have to make sure that the site address to that specific church or that site that you're looking at having the summer program has 50% or more eligible children or is in a census eligible area.
Great, thanks. I'm going to stop.
Hey, Markel.
Share a second. Yes.
If I can just chime in too, that's great stuff that Stephanie just said about the eligibility. But as far as food gatherers goes and helping churches with summer school, we do work with churches on the fact that Stephanie said about the eligibility part. But we also, you have to be open for at least 4 to 5 weeks in order for us to sponsor you. And I know that seems like a lot for summer and staff, but if anyone is interested in doing that, they can contact me, and we have a system set up where it could work for Vacation Bible School. So if anybody wants to talk about next summer, I'd be happy to talk to you.
Awesome. Thanks, Veronica. And that's a great example of a sponsor policy or sponsor decision. That minimum requirement to serve 4 to 5 weeks is not a state or a USDA or congressional rule or law. But as sponsors, food gatherers has to have enough staffing, and there's a certain amount of administrative costs for sponsoring a site in terms of training and everything. And so in order for us to expand to a specific site, that's a decision we have made. There may be other sponsors like YCS or Ann Arbor Public Schools who could sponsor a program running at a shorter time period. So that's just some context there. It's a great example of how there's different rules and they're made by different entities.
Sorry.
Go ahead, Naveen.
Quick question, Naveen. How do you sign up for private schools? And is it only in the summer, or is there a food program that they can enroll in for all year long?
Stephanie, so private schools can reach out to Michigan Department of Education. The school meal programs don't provide meals for free to all students unless they would be eligible for the community eligibility provision. So you'd have to collect applications from families. Families who are eligible for a free meal would get the meal, that student would get the meal at no cost. Then there's the reduced price, and then there's the paid option. So that then families who are eligible for that would pay, $3.50 or $4 or whatever the school district sets up.
Okay, perfect. And then in that sense, the school would have to contact the Michigan Department of Education, correct?
Correct.
Okay, perfect.
Okay. Yeah. We've got our contact information at the end. And again, we're going to share all of this so you don't have to worry about furiously writing that down. What other questions? People can come off mute or pop it in the chat. Any other questions? Someone might be typing.
I do have a quick
Hey,
question,
go
Markel.
ahead.
Your organization, Food Gatherers, where do you get your funding from? Are you guys your own private organization? Are you getting money from USDA?
Both. So we're a nonprofit. So a lot of our funding does come from individual contributions, but we do get funding from USDA through the Michigan Department of Education. So we don't actually get direct funding from USDA. These programs are operated through state agencies. So reimbursement for our summer meals comes from claims we submit to the Michigan Department of Education. They approve those claims, then send us a check. Similar to some programs that we're eligible for as a food bank that are related to emergency food, we do get that as well. But it's a small portion of our funding. And then, as I mentioned, for that staffing and administrative overhead, we do have to secure private funds to help cover some of our administrative costs for running these programs.
Okay, thank you.
Yeah. Okay, well, put questions in the chat. I'm gonna screen share just for this last slide here. Oops.
Oh, I do have a quick question.
Great.
Hi, this is Glenda Wilkes. I'm showing my video here. Will the recording be made available, and when will it be made available of this discussion? There was so much, and there's no way I can digest it all.
Yep, absolutely.
In one sitting, so yeah.
Of course, yep. So we're recording this, and what we'll do is I'm just going to trim the start of the video, so I should be able to send this out next week. It's not too hard for me to edit that. Hopefully, I don't want to jinx myself. So I'll send the recording out and the slides, so you'll have all of that, which includes contact information, links, all of that. So we'll send that out to everyone who registered. So even the people that registered and weren't able to come today, and then the recording will be on our website too, so you can easily forward that or share it with others.
Okay, great. Thank you.
Thank you. So speaking of next actions here, and then we'll close up. I see it's 12 o'clock. So Food Gatherers does do advocacy work. We are in regular contact with our elected officials in Congress and here at the state, really trying to make sure these programs have adequate funding and are keeping up with the needs in our community and the opportunities we have and we see to serve people. So you can sign up if you want to keep up to date on that. We don't send a lot of information out, but we do let you know when there's an opportunity to take action. Try to make it simple. We tell you the number, what to say, etc. So you don't have to be an expert, but we can give you the heads up that there's an opportunity to take action. And we're really pleased this year to have a lot of other partners in our community that are working with us on these child nutrition priorities. It's an exciting year in Congress, both with COVID recovery opportunities as well as child nutrition reauthorization. So stay tuned and sign up if you want to participate with that. And as I mentioned earlier, if you missed the Advocacy 101 training, you want to learn more about like, how do you do advocacy effectively? What are you allowed to do as a nonprofit? We have that training recorded as well, and that's on our website. So check that out and you can go back to that. And then thank you. We're so pleased to be able to do this and have so many of you join us on a Friday. Please reach out to me with any questions. And then of course, Stephanie and Kate, if you have any questions about WIC outreach or any of the school nutrition programs, and then Diana for questions about Head Start. So with that, I will stop screen share. I know many of you probably have to jump off, but happy to stay around if there's any other questions. Thank you all.